Guys, T-Fit here with FBTV. We got them walls out. Junior, unfortunately, we believe has some ringworm. Now, I'm going to finish shaving the general, and then we're going to use these same clippers and try to shave down some of his skin. Fungus thrives in a wet, warm, moist environment. What does that mean? Oh, the dog, he's out in the sun. It's not really dry. Well, when hair overlays it, it actually keeps the said area relatively moist. So what do you need to do? For one, you need to expose it to complete air, which means it has to be shaved down. It's going to irritate him a little bit. It's probably going to be a little sensitive, especially to the vibrations. Look at that there. But also what I learned about the general is if you shave a Jack Russell's hair, give him that first buzz cut, it'll turn around and when his hair grows back, it'll either grow more coarse, less coarse, but it'll shift the whole dynamic of the dog's so-called life, to say the least. And I gave him a little trim, so I'm finished trimming him. General, General. Good boy, good boy. Good boy. Look at that there. Look at that there. Now, I don't cut hair. I ain't never cut hair, I gotta be honest with you. So I don't know if you're supposed to go against the grain, with the grain, what's going on, if we whipping the grain. What I do see already though is he's looking better, which means I hope his hair grow back so I can keep practicing. But we've got it on a relatively low one, and then we're going to use the stripping tool. The stripping cold stripping tool that I have literally assists in pulling any extra hair or dead hair, to say the least, out. Jim was cooperating pretty good. I'm surprised he's not acting like a nut. That's funny. Look at that right there. Now, mind you, I literally have no clue how this works, people. But what I do know is the man needs a lineup. So I'm gonna give him a little light taper. I know, man. I'm sorry. That's the beauty about having a small dog. Look, you can hold him in one hand and do everything else with the other. And you just kind of feel bad for him. Oh, poor General. That's entertaining. I'm actually gonna test to see how Junior's gonna act with just a regular buzz. Let me give me a little light buzz. So Jamarcus know what you got. You know how the barbers be like this. Come here. Come here, Junior.
That's great desensitization right here. Come on.
There you go. I'm just gonna see if it'll. Hey, move.
My boy, Patch. Come on, Patchy. Okay. Oh yeah, you gonna patch this boy up. Don't look like you have real skin problems.
He look like he looked like Will's wife with Ala. No, I ain't gonna do that. But he will have that Pisha. I'm not gonna shave that much because that one's exposed.
Okay. So that's this one right here.
Yeah. So if the dog has ringworm, for one, hey, move, Cha-Cha, move.
Move on the rope, man.
Try to stay still, buddy. You on me? We're changing the knick-knack. There's about 52 knacks in this joker. Chill. There we go. I'm sorry, little one.
I know, man.
Hey, but look though, look at that there. I got him. That's good, bro. Now, a couple things. Ruben's gonna cut into this episode, and what we saw and learned from Ruben specifically is that, for one, anything ringworm related can be passed on to humans. And you need to shave it down. So we shaved it down, so it's gonna help dry it out. Second, I can pop a little water, iodine. I'm gonna clean his feet in the process, and I'm gonna turn around, give him some cephalexin, and a bunch of other things that I'm gonna show you later. Right now, we just wanna see if this would work, which it did. I gotta get out of here. Stay tuned, people. We will be back soon. Listen. So how does the dog get the ringworm, man? Where does that shit even come from?
You know what, man? That's a great question. The other sad question is that it's zoonotic, meaning it's transferable to humans.
Yeah.
But ringworm within itself, it usually, moles carry it, rats carry it, guinea pigs carry it. It's really hard to see, but for the most part, it was transferred by another animal. It could be, and that's the other thing, is that could be transferred by a human being.
That's crazy, man. Because we're trying to figure out where he got it from.
The funny thing is that it's a fungus. It's a fungus. It's not even a real worm. It's a fungus.
Yeah.
So that's the that's the $1 million question, you know, like where do they come from? Because I see your yard. I mean, you keep a tight ship on your yard. You know, you keep your animals well taken care of. You know, the husbandry second to none. So I don't see. I see it if it is ringworm, which you know looks like it. It was happenstance. Meaning, I mean, I'm not trying to put the blame on any of your athlete friends, but you know, ringworm is very prevalent amongst athletes, especially wrestlers.
Hey, no, you know what's crazy? I told Jamarcus, I said, I know how humans get it, that wrestling mat, staph, all those things are passed because of the bacteria buildup, and like you said, the fungus and shit. My brother had ringworm on the top part of his middle head one time, man.
Oh,
it was crazy. Funny, no, it's funny. And then he gave it to me. And so...
Dude, fuck.
So the other thing was, you know, I sent you those 2 videos. I was like, what are we actually looking for as far as reflections concerned? Because I don't know if I was like looking right or what I'm supposed to see.
Yeah, you know, the UV light, it's actually like a very, very dark purple. Like, you know, it's almost like a between magenta, blue, and purple. Yeah. And basically, if you put that light, it will fluoresce the same exact color of that little UV lamp. So, like, when you turn the light on, you know, you put it, like you said, you went into a dark room, bathroom, wherever, you know, we used to use the x-ray room, and you turn off the lights, and when you shine that light in there, if it picks up that, fungus will fluoresce, almost like, when amoeba and certain things fluoresce in the ocean, and they look like a real fluorescent green or yellow or blue. Actually happens a lot in Puerto Rico. And that's what, you know, that's exactly what it is. That's exactly what it'll look like. But it'll fluoresce the kind of UV light that you use. So if you were to use a green one, but the most common one is like that bluish purple one that fluoresces, and it'll just pick up. So if you put it in any other part of that, you know, you're not going to see it. Right when you know, if it picks it up, boom, that's your diagnosis right there. I mean, there's other things, you know, like for example, you know, there's 3 primary things that can happen when a dog has a skin issue. It's either going to be fungus, it's going to be oh my goodness, Demodex, or it's going to be, what's the other one? There's one more, mange, Sarcoptes mange. Those are the 3. I mean, there's other things that can happen, but those are your 3 primary culprits, especially in, you know, in our country where, like, you know, you see the cases over and over and over. Like, just sometimes that perfect circular area is not as perfectly circular as one would think. You know, it's like bokeh balls. You know, we want them nice and circular, but sometimes they get elongated like a football or lemon shape. So, you know, people always, it's not perfectly circular. That just doesn't constitute that it's not ringworm. It can still be ringworm. You know, the other thing, you know, I forgot to add one more thing. That's what's called a hot spot. And hot spots basically happen when an animal is continuously, here we go. There's actually a 5th one. It's called a decubitus ulcer, but we're not going to get into the decubitus ulcer because that's usually when animals are laying down on cement for very long amounts of time and they get a callus, and that callus becomes infected, you know, but that's not what's happening with your dog. I can guarantee you that, because they usually tend to get them around the elbows. So in this particular case, you know, we got 3 culprits. It can be a hot spot, it can be Demodex, or it can be Sarcoptes mange. The 2 aforementioned ones, which is the Sarcoptes mange and the Demodex, we have to do what's called a skin scraping. So we do a little skin scraping, we put it underneath a microscope slide, we put a dab of mineral oil, and then we put a microscope cover. We look underneath the microscope, maybe around at a 10 power, and, you know, so 10 times 10, that's, you know, the amount that it will give you. And I'm sorry, 100, 10 times 100, that's 1,000. And then that's the magnification that you're going to look underneath the microscope. And if it's Demodex, it's going to look like these little elongated cigars. Cigars. Okay, that's Demodex. Unfortunately, if it's Demodex, a lot of time, because we all have natural occurring Demodex. You have Demodex, I have not Demodex. The thing is that our immune system keeps it suppressed. It keeps it under control. Just like we have bacteria, we have good bacteria, we have bad bacteria. We got a very, very good immunological system, then we keep the bad bacteria at bay, because we're exposed to bacteria, germs on a daily, you know. So that right there, if the dog then it's immunologically compromised, then that's where they get the Demodex, you know. So it's almost like an immune response. The third one, which is Sarcoptes mange, it's usually transmitted from animal to animal, and it's not, you know, host specific, meaning it can be transferred from, you know, a wild animal. It could be transferred. Fortunately for Demodex and Sarcoptes, they are not zoonotic, meaning they're not transferable to humans. So with those other twos, there, that's where we could use, you know, medications to start to treat them. And now the hot spot, basically, it's just trapped bacteria. And now that it's moist, and now that the dog's scratching at it, and now that the dog's licking at it, that hair keeps it trapped, keeps that bacteria nice and moist, and just like, oh, and then it starts turning into pustules, you know? So the best thing to treat that is by shaving it down. Boom, we're starting to what's called aeration, aerate it. You know, we're aerating, giving it some oxygen, because some of these certain bacterias, they're not, you know, some of them are lipophilics, meaning philic, lipo, meaning it loves fat. You know, that's basically the translation. And some of them are they don't really like to be around, you know, they don't do well around oxygen. And so bacteria, what does it need? It needs to be in a dark area. So you shave it down, you scrub it down with some chlorhexidine or Novosan, or you can even use betadine or iodine. Just dilute it down, scrub that sucker down, kill the, you know, the bacteria, and just put it on a dose of about 200. I like, for skin issues, myself personally, there's going to be every doctor. I'm not a doctor, but you know, I'm an RBT. So I like the way cephalexin works. You know, it's a broad spectrum. It's not super heavy on the gut, and it's very effective. You know, I think the half time of it is 12 hours. Don't quote me on that. So you give it twice a day to have the most effective outcome.
Oh man, that was, man, look. You got to take it. I feel like you got to take a breath after that, man. I don't know if you was breathing.
I was beatboxing, brother. I was beatboxing, man. The art of noise.
Hey, that's crazy, man. You know what I'm gonna do then? I'm gonna go get some clippers for the dog, and I'm gonna do some videos on this shit.
You use something like a number 10, you know, like a number 10 would work nice, you know, and just remember to shave up against the grain, you know, up against the grain. And of course, you know, it's going to be a little bit tender. And the one on the nipple, that's, and you know what, man, that would be so crazy if that dog had both the skin issues going on at once. I was like, whoa, that's what threw me off. Yeah. You know, that's what threw me off. I said, oh, wow, but it's not that it can happen, but it's very highly uncommon. You know,
guys, I'm here with Stan the Drug Lord, and he ran the numbers. 36. That's 3, right? He ran the numbers, and we got to mix his medicine. I actually wish I just got the pills.
And that's 60.
So now just a half, right?
7. Is it 67 milliliters?
Here's what we had to do. This whole container says, well, this is cephalexin for oral, and it's 125 milligrams per 5 mLs. So Stan ran some equations, and what we've got to do now, we've got to dump this powder in here to make sure that this works.
You dump the water in there. Oh, so then you can keep
that makes sense. Look at this. Guys, I never was going to do the drug thing. I told Chris I wasn't, but then when you get this many dogs, you say, we gotta start learning about these drugs. Oh, look at that. That's pretty now.
And put the top one and shake.
Shake's kind of good too. But like malto meal.
Shake, shake, shake. Shake, shake, shake. And now you got your solution.
So now what we have here is cephalexin.
And then, so how much does the puppies need?
Stay tuned. We gotta go figure this one out. Guys, so we got Stan behind the camera today. Again, Junior has, unfortunately, look, I had to shave it down the other day, and he has a little skin irritation. Show him the ninny. Show him the ninny. Woo, that ninny is something nasty too. It's been growing a little bit. And so Ruben, if you hear this episode, he recommended cephalexin. Now, it's not uncommon for dogs to come in contact with environmental things. Could be anything that passes along ringworm. Ruben said it kind of looks like ringworm. Not for sure. Either way it goes, it is a hot spot and some type of irritation. When you're treating something, it's a technical term. We'll just talk about visible, aka the skin. You treat something on the outside, you have to treat something on the inside because there could be something going on as well. Cephalexin is often used at times for urinary tract infections and bacterial and skin problems. How do we know? Guess what? Chris recommended that I get my PUMS book, and what we have here is cephalexin. What we have here is cephalexin. What it says, drug interactions, fall interactions, reported significant. So also for overdose is unlikely. For one, it's unlikely, but could cause some distress. I'm trying to find the part where it talks about what it's kind of used for. I'm not going to go into, because like I told Chris and him, I don't want to learn a lot about drugs. What I realize is though I have to learn some things, and what that means is we've got a lot of dogs, and not running to the vet every time one of my dogs gets sick because I know how to get the medicine as well. I would encourage you to get the PLUMS veterinary book, because what we did was we walked around, we basically figured it out. Meaning, hey, we got the stuff, let's work through the meals, and let's give him the stuff. Now, two things. I would recommend giving the dog this with some food, if I'm being honest. You just put this over his food. It'll make your life a lot easier. Now, Jamarcus will have to squirt this in his mouth. And when you do this way, slow and steady, okay? Don't choke the dog out. Slow and steady, little squirts at a time. Make sure you get it back in this part of their jaw. I would do it, but he's not my dog. Now, he's not gonna bite me, to be clear. I'm not worried about that. But slow and steady, and be careful because it didn't have a top part on it, so it can leak out. See, boy. A little bit at a time, buddy. Let him swallow. There you go. Half and half.
Come on, brother. Come on, brother.
All right, hold that. We'll do the phone version of this.
Yeah.
Finish him off. That being said, people, we measured our cephalexin. We shook our container. I think I got to put this in the fridge. The second thing we're going to do is hit him with the keto cortisol. Basically, whoo, athlete foot spray.
Can we do it on the bottom too?
Yeah, let's do it on a little bit of the bottom. Hold that Stan. Look, Stan's doing a lot of things right now. Come here, boy. And this is going to help. I'm sorry, man.
Ooh, that do look bad.
Yeah. Yeah, it's not a good thing. That's going to help dry some of that out. A lot of times, doctor would give you shampoo with keto cortisol in it. Uh-oh. This might... Oh, we just did. Ah!
Fumble on the plate.
Fumble. It's oh my goodness, Lord. It's just, you know, if it's not one thing in life, it's another effing thing. It's treat the issue. Now, shout out to my guy Ruben. Ruben did what? He broke down what he believed the problem was. We got some clear videos. I texted to him. Trevor, that looks like this and that. Realistically, you're not going to go and do an excessive derm and all that other stuff with your dog. Meaning like, let me get the skin scrape, let me do this. It gets really expensive. The gist of it is, for a fact, if it oftentimes is something that looks like a ringworm, you turn around and you treat the outside of the skin. Athlete foot spray normally has some type of keto cortisol, and cephalexin is not hard on the dog. That's why they would say, hey, run this. It's not hard. There are medicines that strip the lining of the stomach and they wreck your dog. So you say, hey, you don't want to do this in excess. Trust me, Trev. Cephalexin is not that bad. I believe cephalexin is even one of those things you can feed or use on a pregnant female because it doesn't break the embryonic wall. I believe that's how you say it. Point is this. We'll show you some updates. Hopefully this works. Every 12 hours, Jamarcus has to take this with him and feed it and give it to Junior over the next 5 days at least, and he got to spray a little athlete's foot spray to assist in his recovery. Dog's coming along well. Stay tuned, people. Take care of your dogs. Learn as much as you can. Get you the PLUMS book. You can get it off Amazon. I wasn't going to get into medicine, as you potentially heard in other episodes. We've got 12. We got a lot of dogs. We got a lot of dogs, and these bills, they just keep adding up. And I'm not going to the vet every time something goes wrong. And trust me, I've been so nervous at one point. I was like, yo, Zara was supposed to go to the doctor one time. Ego was acting funny, so I'm like, I just took Ego instead and said, do me a favor, run a heartworm test on Ego real quick, because I was just nervous. Ego, nothing can happen to him. Nothing can happen to him at this moment in time. It just can't. It just can't. I can live with something going wrong, but he was acting weird. He was acting weird, and I do think it was just inflammation and some other stuff, food related. So stay tuned, people. Keep taking care of your dogs. I don't know everything, but if I can help, I always will.